Hello, everyone. My name is Amir Ghaffar, and today I'll be showing you a live solution demonstration of our health and safety access governance solution that helps organizations respond to and safely manage their workforces during and beyond the current health crisis. These are the demo use cases I'll be going through today. We will start with an end user performing a self-attestation about their travel and health status. Next, I will show you how someone who has been in quarantine with revoked access can request reinstatement and provide supporting documentation for an approver to review. Once they have been medically cleared and their access has been reinstated, they're ready to return to work. We will then look at what happens when they arrive to the work site and how they are screened by the reception staff to ensure a safe and secure workplace for all. I will also show you how someone with additional entitlements, such as an HR admin, can update the health status for an employee by accessing their identity profile. Next, we will look at the health and safety tracker, where the intelligence and analytics are happening to detect who is a health risk and how we can identify others who are potentially affected due to close proximity. I will also talk to you about consuming all this data in an easy to absorb manner through dashboards and reports. With that said, let's get started with the demo. So you're seeing me logged in as Stacy Major in a browser window. Our application is browser-based, of course. And Stacy is logged in based on her role, based on her privilege level. She sees a few pods or tiles, and one of those is the health and safety questionnaire. Now, in this scenario, what happened ahead of time is the health and safety access governance solution has sent an email to the entire workforce population with a link to log into the self-service portal and be able to complete the health safety questionnaire or the self-attestation. Currently, Stacy's a remote employee. She poses no health risk. Her health risk exposure level is low, and her badge is currently active. Once she completes the survey and it's processed, we'll see how this information gets updated and changed. So let's begin with our first use case, which was self-attestation. Stacy is logged in and she'll complete the health survey. Any of these questions, any of the form elements, the layout, all of this can be configured to the customer's liking through our code-free configuration. So imagine Stacy has experienced some symptoms, or perhaps she has traveled to a hotspot, or maybe she has cared for someone who is COVID-19 positive. As she provides responses to these questions, the system will determine which workflow to engage if you have a different process for different types of responses. And again, depending on the workflow, depending on the different stages, the approvers, the logic, the decision boxes, all of that will be processed in the background and some end result will happen, which I'll be showing you after I submit this questionnaire. So let's go ahead and attest that Stacy is providing all accurate information and she submits this health survey with a response of yes to one of those questions. As you can see, her response is submitted, and now somebody else has to take action to do something with that. So now what I'm going to do is I'm going to show you what it looks like from the approver's perspective. So imagine after this request has been submitted, an approver receives a notification or an action committee member receives a notification that says, one of your employees has completed a health survey. Please review and take the necessary action. So now we're going to go and log in as one of the action committee members. I've already logged in as Arlene ahead of time in a different browser window. So Arlene is one of the action committee members who's received a notification. She clicks on a link and she arrives in her work item inbox. This is where she'll be approving any of the different work item requests that may be available. We're going to be focusing on the health and safety aspect, so we're looking at the self-attestation submission that Stacy provided earlier. Arlene can open this up and very easily have all the information she needs to make a decision. The system has already determined what the response was and what needs to be done. So we've automatically determined that this person is posing a health safety risk and that Arlene should go ahead and revoke that access by selecting the checkbox and clicking approve. But while we're here, let me also show you what the workflow looks like. Here's a sample workflow in our demo environment. where we are simply seeing after somebody submits a health survey, do they pose a health safety risk? If no, there's auto approve, their access stays enabled. And if they said yes, which in this case she did, it goes to an action committee to take some action. Now the workflow can be configured any way you want. The information on this approver screen can be configured any way you want. We can add information, change the layout, a lot of different capabilities. But the idea here is that an approver has all the necessary information with the help of the intelligence in the system to finish out this request. So as an approver, as Arlene, once she is satisfied, she'll go ahead and submit this request. And now Stacy will be notified that your self-attestation has been completed with whatever the result of that is. And now if you want to look at Stacy's information and see how her health risk or her health status has changed, let's go take a look at that. So searching for the same identity information for Stacy, we'll see that her health risk status has been changed to yes. Her health risk exposure level is the maximum at 100, and this was a result of some or all of the questions that she responded to in the survey, and we have automatically disabled her badge. What this does is your remote workforce can automatically, seamlessly, easily submit this information. Perhaps you have a very large workforce of 100, 200,000, maybe 500,000 employees and contractors. And this is how easy it is for you to be able to expose the self-service portal link to them via an email, and they can complete this survey to ensure that no necessary risk enters your workplace and you automatically disable these badges. Now, what I showed you was through an approval mechanism where Arlene was approving this. But if you wanted to configure the workflow such that the moment someone answers a particular question with a yes, and that increases the threshold of the risk exposure level above a certain threshold, we can automatically disable that badge without any human intervention. So there are multiple options in how you can manage that. Now let's go look at the next use case. We'll go back to Stacy's login. And now Stacy's gone into a 14-day quarantine period. What can happen is you can configure this email to automatically go out to Stacy every 14 days or whatever that parameter is, and she can do the self-attestation again. So basically rinse and repeat until she is cleared of those symptoms that you are concerned about. But let's say at some point she is cleared of those symptoms, perhaps earlier than the quarantine period, the second or third quarantine period, and she wants to request reinstatement. Again, she can access the self-service portal with her corporate credentials, request reinstatement, and over here, you can display any information you want. You can provide any additional instructions you need. If you want them to submit some specific information, whether a medical clearance certificate, discharge paperwork, we can provide the option to update or add those to the notes and attachments section. And this can be specifically configured for different locations. Perhaps in some Asian countries, if you have a location, they may have more stringent policies about returning to work. But if you have a corporate location in the US, maybe you have a different set of rules and policies and documentation that's required. So all of this can be configured per location, per geography, per different scenarios. So imagine she's uploaded some information about her medical clearance, and she'll submit this information. And once she submits, the idea is that an approver in an action committee will receive this information, and they'll be able to approve her request. If they're satisfied with the information that has been presented, they'll be able to approve her request, and her access will be reinstated. So let's go quickly look at that. And as you can imagine, the process is going to be similar to the self-attestation. Arlene's a member of the approval committee. She's going to receive the request for reinstatement, and any information you wanted to include in this reinstatement form can be provided, and Arlene can easily approve this request. So the system is determining that this person has completed their quarantine period based on the submission. You can review any notes or attachments that were provided. And once you make the determination that this person is clear to be returning to the work site, their access can be reinstated. Once the access is reinstated, Stacy will receive a notification like she did in the past, and this time her access will show that her badge is active and she does not pose a health risk. Very easy, very simple, very intuitive, clean interface. You don't have to worry about any ambiguity, fairly self-explanatory. So now that she's been cleared, let's see what happens when she arrives at the work site. So imagine she's coming into the work site, she feels great, she's healthy now, and she is going to engage with someone at the lobby who's going to be in the reception area, who's doing screening for employees on a daily basis who are arriving to the workplace. So I'm logging in as Annie Mordino. She's part of the reception staff or the lobby ambassador, and she's the gatekeeper who's ensuring that nobody gets past her into this facility unless they are medically cleared, unless they are safe and sound, so that way we keep a safe and healthy environment for everyone else. So as Stacy arrives, she's gonna engage with the reception person, Annie, and Annie can update the employee health information for Stacy. So by looking up her profile, Annie will pursue to complete this information. Now you notice here, we have a different set of questions. And what we're demonstrating here is that you can have different interfaces, different forms, different layouts, different flows based on your needs. So in here, if she has none of these symptoms present, she would be cleared to go. But if she answers yes to, let's say she's experiencing a fever and she submits, whatever your business process is for that, we would engage the particular workflow and enforce those rules, policies. Perhaps she's showing an estimated temperature and your policy is immediately revoke access, notify your health management so that way they can assist her to be able to take care of her for whatever the next steps might be. So this is how easy it is for someone to be able to do screening at a work facility as you work towards bringing your workforce back. A lot of customers are planning on doing this in a phased approach, in waves, and they certainly need to consider a solution that is comprehensive in being able to not only provide the self-attestation remotely, the request for reinstatement remotely, but also when someone arrives at the work site at the physical location. Now let's take another scenario. Let's say one of your employees, God forbid, has COVID-19 symptoms and they are in the hospital. They can't access a self-service portal. They obviously can't come into the facility. What happens if they are simply communicating with their manager or an HR administrator that they are sick, they can't come in, these are their symptoms, and they're going to be out on sick leave? So as an HR admin, someone can log into the system and update this information for this individual as well. So let's take Charles Mordino. He's the HR admin. He has elevated privileges or additional entitlements. And when he logs in, he sees a different pod or tile called Health and Safety Admin. And in here, he can update the health risk exposure level of any individual. So in this example that we were talking about for Stacy, or an employee who's out sick, they can't access the self-service portal, Charles can update the information on their behalf. So here's some examples of some symptoms and some thresholds around them or the risk exposure level around them. So as an administrator, I can easily say that this person is tested positive. I want to go ahead and submit this. And I know in the background what that means is that their risk score or their risk exposure level will be changed to 100. And of course, this is all configurable. The parameters, the thresholds are configurable. So depending on which information I provide, what information I select and submit, the health risk and the exposure level will be impacted accordingly. So let's say she has tested positive and we will submit. And in this case, what you'll see is there's no, this is an auto approval, and we'll see that Stacy's information is automatically, her access is automatically disabled. So we can look at Stacy's information through the global identity search. And what you'll see is The same information we saw earlier when she submitted her self-attestation and reported positive or reported having symptoms. We've disabled her badge and updated her profile to reflect the same. So again, multiple ways on how we can capture this information remotely through self-attestation, in person through screening, or if someone's contacted their admin or manager through email or phone, we can update this information. All of this works towards preventing that risk from entering your organization. Now, the flip side of that is the detection aspect. What happens once someone has already been identified as a health risk? Now, in this scenario, what I'm going to show you is, let's imagine somebody's been coming to work on a regular basis for the last week, for the last few weeks, and all of a sudden they call in and they say, hey, I am no longer feeling well, I am experiencing these symptoms, or they complete their attestation or survey and say, I'm sick now. So what do? Organizations need to have a mechanism to be able to keep the rest of the workforce safe. And what that means is you need to understand where this person has been within your facility, what areas they have possibly contaminated, but more importantly, who else was present in those areas at the same time. So that's where our health and safety tracker component comes in, and where we are able to do those deep analytics, the intelligence, the integration with the physical access control system, the integration with the SAP success factors or HR authoritative sources, and blending and merging them all together to be able to make some sense of all that data. So here in this interface, what you're seeing is all the people who have been affected, whether they have submitted a survey, maybe the health administrators update their profile, or they've been screened and denied admission to the workplace. But in our case, we're looking at Stacy, who has been identified as someone who was in the workplace previously, and now she is sick. Because we are connected to the HR system, we can easily pull in our HR details. Because we're connected to the physical access control system, we can easily see all the swipe locations. So let's see what that contact tracing looks like, how we can identify her as having been an individual with critical exposure. So what we're doing here is pulling all the badge swipe data, badge swipe activity that she has incurred recently. And this can be all configured based on a date range, based on a time range, and so forth. So the idea here is we want to quickly look at the contact activity for Stacy, who else was co-located, who else swiped in the same locations where she was in the last few days. So she had visited the lobby, her work area, the data center, perhaps the gym or the lab and the cafeteria. So we know that these are the areas she was in. And then we are also showing you multiple columns from highest exposure to lowest exposure of individuals who were in those areas around the same time. And this is a configurable parameter, and we're identifying if someone was in the lab, in the lobby, within 30 minutes of Stacy, then they are going to be considered to be of the most critical exposure based on proximity of time in this case. Anybody who's been in those areas further out in time, they are considered lesser and lesser risk or lesser and lesser exposure. And again, these are just parameters in a demo environment that can be configured based on the customer's appetite for risk and thresholds. The idea being that we are able to cross-reference any areas that Stacy has been in, as well as other employees have been in. Now, another way to display this information or this information matrix is by overall proximity of scope. And what that means is, in the previous example, we simply said if you were co-located with Stacy. What this is showing you is how frequently you were in those locations or how frequently you interacted with Stacy throughout the day. So let's say one of these individuals were present in the lobby within 30 minutes of Stacy being there. They were in the cafeteria at the same time. Their paths crossed in the elevator bay, which is access controlled, as well as in the gym. So because they've had additional exposure or repetitive exposure, they are considered a greater risk. So this is another way of capturing that information and bundling it in this information matrix, where we're showing these are the people who have had the most consistent or frequent interaction with the person who has been who is the catalyst, in this case, Stacy. And finally, the third way we're displaying the same information is from a space or location perspective. This shows all the areas that Stacy was in, how long she stayed there, and wherever she stayed the most, those locations are going to be identified as critical. And so that way you can determine whatever your mitigation strategy is. You can sanitize those areas, lock those down, however you want to react to that and mitigate and reduce the risk. So the same information is presented in multiple ways, but this is all possible because of linking HR to physical security and the physical access control system. And then of course, our expertise of being able to understand risk, health, safety, analytics, AI, intelligence, all of those things combined, and that this is the result of that. And this is ultimately how we're able to do that contact tracing, how we're able to identify those areas that are possibly contaminated, how we're able to identify those individuals whose access needs to be revoked and health management needs to engage with them to take the next step. One of the other use cases around this is the social distancing analysis. You know, a lot of workplaces are not only enforcing the screening, but they're also instructing their employees to observe social distancing. Make sure that you're staying 6 feet apart, 8 feet apart, whatever that might be. But because workplaces are large and staff is limited, you can't monitor all those access points. So what we have is the ability to be able to show you how far apart those badge swipes are occurring from different individuals. So let's say if somebody is swiping 1 second apart, or if somebody is swiping 2 or 3 seconds apart in these locations. Let's say you have a line for the office or the elevator bay or the cafeteria or the gym, and if we detect swipes that are only 1 or 2 seconds apart and you have multiple identities accessing those areas, we can conclude with reasonable degree of confidence that they are not staying far apart or observing that social distancing. And perhaps once you observe that, you can send somebody to monitor that area or implement some change management, again, as a measure of ensuring greater safety and security and reducing that risk. So those are some of the scenarios that we had talked about from a health and safety perspective. One other thing I want to show you is the ability to be able to have all the different reports and dashboards. We have over 50 canned reports that are available out of the system, and some of them are health and safety related. And you know, we have several reports, so they can be permission controlled, they can be automatically generated, they can be exported in CSV, Excel, all the popular formats. They can automatically be emailed at intervals or on an event basis to an individual or a group of individuals via email. So a lot of different options. We also have a reports designer tool where if you wanted to create additional reports, you can easily drag and drop and create your ad hoc reports. And of course, any of the reports that are going to be in table format are going to have columns and rows. Of course, those are available, but also those reports power our visualizations or our dashboards. And what happens is you can easily at a glance get a complete status of what your health of your organization looks like. In this demo environment, I've enabled some additional capabilities around visitors and physical identity access governance, but I'm going to focus on the dashboards for health and safety. So you can easily see at a glance which part of your population has completed the health survey and who haven't. And in this case, if your rule is, hey, send them a nudging email again or nag them again and ultimately disable that access if there is lack of adherence or compliance from their end, we can automatically do that. If you want to know which individuals have observed the symptoms that reported to be COVID positive, what are the contact tracing metrics here via the dashboards, how you can do the risk score heat map, various different mechanisms of being able to absorb this information through the reports, through the dashboards. We have all of those capabilities available. So those are some of the quick scenarios I wanted to show you from our health and safety access governance perspective. I hope you've enjoyed the information and demo you saw. For additional information, please visit our website at alertenterprise.com or email us at info@alertenterprise.com. Thanks for your time and have a great day.